surgeries that have a placebo effect, placebo. So surgeries do help when they're done according to the right diagnosis. But if it's missing and it's happening, then two things might happen. Either the surgery is basically is harmful, or there may be no apparent obvious harm, and actually even initially after the surgery the person feels better, and we are talking about musculoskeletal problems, right? Like chronic, not acute. And so after the surgery the person feels better, and then the effect disappears, which proves again that the surgery had only the placebo effect. Why are we talking about this in the first place? Because today so many surgeries performed routinely for bigger and smaller musculoskeletal issues. And one thing is when we have an acute injury, maybe because of accident, car accident or skin accident, but very different thing when the person has a chronic problem and then they are prescribed surgery to repair so-called injury or structural damage, while there can be none. And actually this is why we are meeting through this medium, through Facebook, through this platform, and why we are talking about how to avoid pretty drastic procedures, treatments that might not be necessary. And through my experience, through my training, through my own experience, my family, my friends, my clients, I did learn that such a problem exists, and I would like to bring it to your attention, guys, okay? So just know that if you are in a situation where the pain lasts more than, let's say, 3 months, know that there are mechanisms in the body that, not just one, a few main mechanisms, and then extra mechanisms that heal the tissue. When you cut your finger, it heals within the few days. And just know that the longest, biggest bone in the body, femur, heals within 2 months. And anything that does last longer indicates that the issue might be not as straightforward. Maybe there are other things that cause your pain, and I'm hinting at basically life situations, emotional traumas, internal conflicts that can create and mimic injury. So again, our topic today is placebo effect of surgeries. I just want to bring it to your attention, guys, that oftentimes these days, more often than before, people undergo surgeries that actually they do not need. This is not a medical advice, and I'm doing my disclaimer right now at this point. Please use your judgment, use your common sense, go see a doctor, go get a second opinion, but I don't want you to be in a situation where you have to go through pain and suffering, lengthy recovery time, and then loss of hope. But most important injury through getting a procedure that we don't need is probably emotional scarring, because while you're waiting for the surgery, while you're under the surgery, after, you are basically cementing that belief that something's wrong with you structurally. And this is how today's industry of musculoskeletal pains, complaints, operated under the structural model. And I would like more people to learn about that fact, that this is what is taught at medical school. This is how doctors are viewing the clients. They expect, if there is a pain, they expect there to be a structural problem, and these days we learn more and more thanks to the doctors like Dr. Hanscom, orthopedic surgeon, Dr. Jack Stern, that this is not the case, that oftentimes it's not the structural problem issues that cause that pain, but more and more difficult situations in life, and those emotional pain that it can mimic so well injury or structural damage, and sometimes doctors are at a loss. They don't know how to explain, but very important thing is that oftentimes surgeons have to make a decision about operating or not within the first consultation. Just think about it. How important is that issue? Pretty important, right? Somebody is going to make an incision, cut your body, and the decision is made within the first consultation. So Dr. Hanscom and Dr. Jack Stern also talk about that more time needs to be spent for doctors, and if it's you or your family member who is dealing with this problem, make sure you get a second opinion. Make sure that you explore all other options before deciding on surgery. And just a few issues actually are operable. Most of them will resolve by themselves or with some attention, including psychologist, meditation, yoga, simple exercises, learning stress management. So all of those things. Guys, don't ignore things that you hear, incorporate and get better. You know, when we have stressful times, then, well, you might experience more pain, but life changes, right? Everything has a beginning and end, and hopefully your pain as well. No pasaran. Thank you for tuning in. Talk to you soon. Have a wonderful evening. Bye.